This is Belleville General Hospital, site of the Stroke Rehabilitation Unit of Quinte Healthcare Corporation in Belleville. Over the next while, this video will introduce you to several of our highly trained and skilled rehabilitation specialists. Some of them may be working with you during your rehabilitation program to help you achieve your goal of the maximum possible independence. You will also see some of our facilities along with some of the types of therapy that we provide. And now, please meet our physiatrist, Dr. Julian Harris.
I'm looking forward to welcoming you to the rehab floor here at Quinte Healthcare Corporation. As a physiatrist, my specialty is rehabilitation medicine, and I believe I have the best job in the world because you, like all my other patients, get better. That's why you're coming to the rehabilitation floor. When you first come to us, you're likely to feel overwhelmed. We have a lot of therapists here and nursing staff and doctors in a high ratio to patients. This means that you'll be getting a lot of therapies every day. We encourage you to go home on the weekends, but whilst you're here in the hospital in rehabilitation, we keep you very busy. And I'll try to hang on to you for as long as you're doing well and improving. Our goal here is to get you home. And we're likely to achieve that with weeks and weeks of therapy, but we will keep you in the hospital, in the rehab floor, for as long as we feel you're benefiting from rehab.
Hi, my name's Lois Stather and I'm the team leader on the rehab unit. I'm a registered nurse. You can contact me with any clinical issues that arise while you're a patient on the rehab unit, and when I'm not available there is a nurse in charge assigned who can deal with issues as they arise, or they can get messages to me. I will be your liaison with the doctor if you or your family need to get a message to the doctor, or if the doctor wishes to give you a message and you're not available, I will be that message delivery person.
I use different leisure activities based on what people used to do previously, so they can relearn how to do different activities such as knitting, gardening, woodworking, whatever they prefer. When somebody has a specific need, I work on a one-to-one basis, but we regularly provide group participation programs for people throughout the week. People love coming down to the patient garden. They've planted all the plants by seed, were originally started, and then moved out for the summer, and then we'll enjoy some of the vegetables and fruit out there. As well as patients really enjoy some of the entertainment that comes in, the piano, the sing-alongs, those type of activities. We actually use the mobility bus, and we go out into the community for walks or picnics or to the mall to help people get accustomed to going home and being used to being in the community. Also to educate them about some of the accessible resources out there for them.
Hi, I'm Andrea. I'm one of the occupational therapists that you may be working with. An occupation is any activity that you do that has meaning. And at first we'll work on enabling you to do the basic daily occupations such as getting dressed, washing up, and other self-care activities. We'll work towards the level of independence that you set in your goals. I may assist you in relearning how to do the activities through practice, education about devices and other methods, or look at changes in the environment that could be made. We may work on how you see, think, or move towards objects. There is an occupational therapy gym, kitchen, and bathtub to practice safe life skills in. We will work together to enable you to do the occupations you may need to do and ones that you enjoy doing.
Hello, I'm Natasha, your physiotherapist. Well, in physiotherapy, we plan an exercise program and we improve your joint mobility, your strength, your balance. We improve your posture and your ability to mobilize and move around as independently as you can. Your physiotherapy routine is to come in daily for a physiotherapy session of about half an hour to 45 minutes. Someone will succeed in physiotherapy if they have a positive attitude, if they are willing to participate, which is all a major part of the progress towards their independence. The physiotherapy team look forward to meeting you and working with you.
My name is Sean. I work here on the rehab floor as a speech-language pathologist. Most of our patients that are seen by speech-language pathologists are stroke patients. They have communicative disorders such as they have difficulty expressing themselves, they may have difficulty understanding, or their speech may be slurred. If their speech is slurred, for example, we will do some oral motor exercises where we will strengthening of the tongue, the lips, the jaw. We'll do some of those oral exercises. We'll also get them to repeat some words that may practice over-articulate some certain words.
My name is Marilyn Wolf, and I'm the clinical dietitian that cares for the patients on Quinte Rehab. As a dietitian, I will be interested in what you eat, when you eat, how much you eat, and any special diet that you may follow at home. When you are admitted to Quinte 4, a diet tech will visit you to find out what foods you like and dislike. She will also ask you questions about your appetite, whether you have any problems with chewing or swallowing, and any special diet that you are on at home. Special diets that we see commonly are a low sodium or low salt diet, a low cholesterol, low fat diet, a diabetic diet, and also a dysphagic diet. That is for those patients who have problems with swallowing. I will also be visiting you to assess your nutritional status and to provide you with any teaching that is required. In hospital, you will receive 3 meals and snacks or nourishments as required. The menu is based on Canada's Food Guide. Together with the diet that you are on and your food likes and dislikes, your menu will be determined and will actually be printed on a meal ticket by the computer. On the meal ticket is the extension that you can phone at any time during your hospital admission if you are unhappy or have questions about your menu. I look forward to meeting with you and caring for your nutritional needs while you are on Quinte 4 Rehab.
Hi, my name is Mike McCoy. I'm one of the pharmacists at Quinte Healthcare, Belleville General. I may be one of the pharmacists that will be assessing your drug treatment. Primarily, we assess the patient's drugs, looking for appropriate therapy, side effects, any drug interactions that may go on. We're also available as a resource to doctors and nurses, and we can do a consult with the patient if the patient requested. We are involved in Coumadin teaching. Any aspect of the drug therapy that we can be helpful. If asked, we can set up a care plan for the patient and monitor the effectiveness of the drugs while they're in the hospital. Also, when the patient leaves, we can interact with the drugstore as well if they have any questions about their therapy.
Hello, my name is Paul and I'm one of the RPNs on the floor, and this is a computer on wheels. This is something that we're going to use to get your medical history and also to put the information we'll gain on a physical assessment. The physical assessment is going to be done once a week, and it's going to allow us to know of any concerns that we should be aware of, also of any changes, and we'll address those changes. If there's a problem, we'll get on it right away. We'll take it to the appropriate steps, to the appropriate people, and take steps to correct it or make the doctor aware so he could make any changes that are necessary. Right here at the foot of the bed, you'll see the communication board, and that's used for therapy use only. And here you'll see a laminated sheet, and on it will be the different therapists and the times that you're supposed to be at the different therapies, so that you can know and so that we can know when you're supposed to be there. Also on this communication board will be instructions as to any swallowing difficulties or that sort of thing that the speech therapist has identified, any positioning requirements that the therapists have designated that we need to be aware of, so when we're caring for you. And also, one of the things that's put on this particular laminated sheet is the date of discharge, and that's always an important thing, and it's set towards the end of the rehabilitation, and something that encourages a lot of patients maybe to work a little harder towards the end.
My name is Marian McGuigan. I'm a registered nurse, and I'm the continuing stay coordinator on Quinte 4 Acute Rehab. I'm involved as a part-time member of the rehab team, and I'm here to provide a resource to the team, the patients, and their families regarding the discharge plan. Discharge planning for any patient on this unit begins the day they enter our unit. On an ongoing basis, if the need for a discharge plan changes, then I would get involved. The majority of patients who come onto our acute rehab unit will have their treatment, their therapy, and they will go home. It's only when that plan needs to change, when those goals can't be met, that we'll meet with the patient and the family as a team and change the plan. The team that I belong to outside the unit is called Utilization Management Service. There are continuing stay coordinators throughout Quinte Healthcare. We've developed a brochure to help families, physicians, other members of the healthcare team understand what the role of a continuing stay coordinator is, what are some of the things that families and patients might run into if the plan is not home, and it's a resource there for them. It's available on all the units, as well as a list of all the continuing stay coordinators throughout Quinte Healthcare and where they can be contacted.
Hi, I'm Rita Cowie. I'm an RN on Quinte 4 Rehab, and I do chaplain duty as a volunteer. You can ask your nurse, and she'd be able to help you to get a minister that's on call to come in and see you. Or if you wanted somebody specific, a specific religion, she'd be able to call that parish or church and leave a message with them that you would like to see someone. Yes, it's open to patients, their families, and visitors and staff. Anyone, and it's open 24 hours a day, every day of the week. The door is open. Yes, there's always a minister on call, and if by chance something that you can't get hold of them, there's always the Reverend Shirley Scholdice and Reverend Watson that you can get them. They've got their home phone numbers. And something else I didn't say earlier, they all have Bibles at the bedside, and if there isn't one and you request one, we can get you a Bible.
While you are with us, you will be staying in a room similar to this. As you can see, arrangements can be made to rent a television set for your private enjoyment. To help you prepare for your transition to rehabilitation, you'll find it useful to bring the following items: comfortable clothing that would be easy to put on and take off, comfortable lace-up walking shoes, and if you use any of the following: glasses, dentures, hearing aid with spare batteries, a wristwatch will be very useful, a calendar, and toiletries such as Kleenex, shampoo, a comb and brush, toothbrush and toothpaste, electric shaver, makeup, and so on. A copy of any special diet which you have been following at home, any equipment that you were using at home prior to your admission, for example a cane, a walker, or foot brace, all medications that you were taking at home prior to your hospital admission, and so on. You are encouraged to be as independent as possible, and those who are able can do their laundry here. If you or your families are not able, our staff will be happy to assist you. As Dr. Harris explained near the beginning of the video, our goal is to get you home. He also mentioned that we encourage you to go home on weekends whenever possible. To help you travel safely, you will receive training on transferring in and out of cars. Here's our team leader, Lois Stather, once again, to tell you more.
Temporary leaves or passes are an integral part of the rehab stay. It tests the appropriateness of your discharge destination. Family and friends will need to be available to you to take you out on these passes. They will be taught the proper way to get you in and out of a car or a vehicle without hurting you or them.
There are a number of amenities for you and your family to enjoy during your stay with us. In addition to a cafeteria located in the basement, there's this very good restaurant on the main level. This snack bar and newsstand is located right inside the main entrance. The gift shop, which is operated by our volunteer department, is exceptionally well stocked and offers a variety of goods not normally found in hospital gift shops. For your convenience, there is a hair salon right in the hospital. Metered parking is available for single visits or short stays. For multiple visits and longer stays, monthly passes can be purchased. The staff members that you have met in this video are part of a larger team, all of whom are ready to work with you to help you succeed in your rehabilitation program. We would like to thank the members of our team that helped us produce this video. Special thanks go to Mildred, Harry, and Betty.